Interesting. Okay, let's talk about Liverpool then, because cases overall, this is official figures. I'm not making this up. It's not a matter of opinion. Official figures show cases overall peaked a week before the Tier 3 restrictions were imposed on the 14th of October. They have dropped steadily ever since. There's no noticeable drop-off after Tier 3 was introduced. And if you mention the age breakdown, there has actually been a significant fall-off in the 60 to 69-year-old age group, and the median age in ICU currently is 61. So there's the cases in over 60s are the what's that drives admissions to hospitals. Those are the people who have to worry about getting sick, getting very sick, and then possibly dying. And cases in over 60s have actually gone down in the last 3 weeks. So those are the official figures from the NHS. And you're telling me, no, those cases are on the up.
Well, what we're discussing today, Julia, is that in Liverpool, we're going to be introducing mass testing, which will help to take forward the efforts that have been going on, I think with great success.
Are you going to address my question, sir?
Well, I'm not sure what figures you're quoting.
You're not sure what figures I'm quoting. Well, I mean, I can send them to you afterwards. They're from the website coronavirus.data.gov.uk, the official government figures on coronavirus. I don't know if you're going to count those as trustworthy or not. The official figures tell you that the infection rate is going down, admissions to hospitals are going down, over 60s admissions to hospitals are going down, and they were going down before you even had Tier 3 in Liverpool, and they're still going down now. And you've just told me, no, they're going up, and that's why we need to have a lockdown. I'm telling you, if the reason why you think we need a lockdown is because infections are going up, you're wrong.
Well, the rate of infection, let's step back. The rate of infection is above R is above 1 in all parts of the country.
But going down.
The number of cases is rising in many parts of the country. And the very clear advice was that NHS hospitals were likely to be overwhelmed in many parts of the country.
Even though infection rates are going down.
You might take that advice lightly. I think the Prime Minister was right to take that seriously. And I think most reasonable people listening to your programme today would say that if a Prime Minister is advised by the NHS, by the Chief Medical Officer, the NHS was likely to be overwhelmed despite all the extra capacity.
Despite infections going down.
By the first week in December, that we therefore need to take further actions. As I say, it appears that your argument is that we should ignore that advice and take
My argument is that we should look at the facts.
Right.
I know this is old-fashioned, but I think it should catch on at some point when we are looking at destroying our economy, destroying people's lives and livelihoods. Yes.
Well, I think you're making a false argument there, because none of us would want to be taking these measures lightly. You can see that there were many others who were asking for further measures, for full national lockdowns, long before we took this difficult decision. For us, it wasn't something that we relished. We want to protect people's livelihoods, and we're acutely conscious of the impact of these measures. But we do have to take heed, in the end, of very stark advice.
All right.